My name is Jeannie Pomanowski. I'm a retired school teacher, and I live an active lifestyle. I enjoy playing pickleball, tennis, golf, ride my bicycle. I enjoy my winters in Florida, and I enjoy my summers at the Jersey Shore. I had a total left knee replacement, and my doctor was Dr. Chalnick. My symptoms before surgery were joint pain, total joint pain in my left knee. I experienced this pain no matter what I was doing. Anything that was weight-bearing for me gave me pain. Walking, playing any sports, any type of activity like that gave me a lot of joint pain. Even when I stood for lengthy periods of time, I would get a joint pain. So it really did curtail my lifestyle quite significantly. I decided to go ahead and have the surgery because my active lifestyle was so diminished. And I really couldn't enjoy myself. I couldn't do the things that I normally enjoy doing. So I did opt for the surgery because I was always in pain no matter what I did. I found Dr. Chalnick through a co-worker of mine who had knee surgery with Dr. Chalnick in previous years. And so it was through that co-worker that I decided to contact Dr. Chalnick. I was quite anxious going into the surgery because I really did delay it for many years, and living with the pain just became unbearable. So I spoke with Dr. Chalnick, and he did tell me this, which was interesting. He said, "You will know when it's time." And I really did know when it was time because, as I said before, I really had an active lifestyle prior to getting this intense pain, and so I wanted to recover and get back into that lifestyle. So my experience was that I was very well prepared for the surgery. And I went through the class that I was told to go through. I had post-op and pre-op tasks that were given to me by way of email that I went through, and that really did a very good job of preparing me for the surgery. My experience at Monmouth Medical Center was fabulous. Before I left the hospital, they instructed me on how to use the ice machine and how to put on the compression socks that were an important aspect of the recovery process. It's been 7 months since my surgery, and I feel fantastic. In fact, I was ready to go out there and resume all my activity probably 4 months after the surgery. I was able to have complete flexion and extension of my knee, which was really significant, really significant. I feel fantastic. I'm totally engaged in everything I did back when I was 15 years younger. As I said before, I'm playing pickleball, I'm playing golf, and now I don't have to take a golf cart. I can walk the links, which is a big improvement. I play tennis, and as I said, I'm able to dance. Prior to the surgery, I would possibly do 1 or 2 dances. I'd have to sit down to recover. Now I can dance for 2 hours at a clip, so I'm really happy about that. My advice for those who are considering surgery is this: if you are not living your best life because of the pain, then I suggest you seriously consider having the surgery, because it's totally life-changing.